You'd have been more than welcome though, Stephen, I can assure you, don't worry. So thank you all for coming this Tuesday evening. My name's Sam Howard, and Rob is our compere almost for the evening. He's chief in charge of the slides. I'm one of the clinical leads who works for the Greater Manchester Training Hub, and I'm the clinical lead for the multi-professional roles within the GP Ready programmes that we have. So the extended team within the GP Ready programme is myself as the clinical lead, who has oversight from a governance and almost ideas point of view and keeping things on track. We've also got this fantastic mix of different disciplines that really make it just a truly rich learning environment. We've got our pharmacy person who's involved, who's fantastic, is Shan. I think she might even be in the room actually, so I'll not say too much to embarrass her. So she can offer clinical and practical input. We've got Cora, who's a fellow advanced nurse practitioner with loads of experience in advanced practice and clinical training. We've got Sarah, who is one of our clinical educators as well, who's a registered nurse adult branch. So just not to get confused, that's nothing to do with the RNA, nothing to do with the COVID vaccine or anything else. It's just a specific arm within the NMC branching. Then we have Ricky, who's a physician associate, who's got a vast experience of teaching and training and education for various professions. And then we've also got Dr. Kelly, who's working with us, who's a GP within the Greater Manchester area, and also one of the medicines management lead, who is almost a gypsy with special interest in IT, really, and digital technology. So we've got this really great mix of different disciplines and also skill mix that we've pulled together to make sure that we've got this really robust and innovative and forward-thinking programme that we can offer the pharmacy techs within general practice. So what is its purpose? So the GP Ready programmes make up quite a vast array of programmes that we've got within the Greater Manchester Training Hub that were commissioned locally to deliver. And some of them are part of a national initiative that you might be familiar with, which are for our GMC and NMC registrant colleagues. But the disciplines that we work with are our first contact practitioners. So that's the 5 disciplines that fall within that category. The physician associate colleagues, and also pharmacy technicians. So these are the specific roles within our multi-professional team of professionals that we've been tasked with putting together a programme that can help support and embed these specific roles within general practice. Because I'm sure if any of you who've got pharmacy technicians in the room, if any of you are in post and presently working within general practice, I'm sure you'd agree it's a speciality in its own right, and it's quite the learning curve that's needed to work it within general practice is quite a steep learning curve, and it's things that you didn't think you'd need to know that you do need to know, and it's quite bespoke. But with that, it makes it really exciting and this fantastic opportunity, and the opportunities that are open that you can develop your skills whichever way you think, or the network think is best for your skills to sit. Within all the GP Ready programmes, we've threaded through some common themes that we feel is necessary for everybody within general practice. So irrespective of background, all the GP Ready programmes will have a good induction, peer support, some elements of clinical training, which this programme does too, and there's always quality improvement in there, so that we can always, it's kind of evidencing our practice works and pushing us to the limit to see what can we do and how can we improve things, how can we improve patient care, but then evidencing it, so that it's not just our opinion, that we've got data to back that up and we've got proof to show that we've made an impact, a positive impact. So taking a step back and looking at general practice and thinking of how would the role of the pharmacy technician fit typically at network level, because within the reimbursed roles, which has really accelerated the utilisation of the pharmacy technician, is how would that fit, and what skills would be useful to have in that position. So we've walked you through, it's also a 20-week programme that starts on the 23rd of November, and it's a step on and step off programme, so often it's a rolling programme, so that we know that real life isn't that simple, that everyone will start on the 1st of August and being posted on the 1st of September. So it might be that due to recruitment, things take time, don't they, to get references, adverts out. There's ongoing recruitment within certainly the reimbursed roles. So our first week will always be our induction to the training hub, just so you get to know us, the team, and what to expect from us, what we're going to expect from you. And we'll walk then through, I think you've gone back a slide, Rob. We'll walk you through and then different other clinical skills. And then one of the things that I wanted to really make sure that we'd covered all bases really. So from my personal history, and I love feedback, I love I love a good critical friend, is that historically the pharmacy technician role had been one of patient safety, but predominantly around the audit of interrogation of clinical systems. And it's not typical for a pharmacy technician to have direct patient contact, to be directly patient facing. And with that, it brings it a whole new layer and a whole new world of your role. So I wanted to make sure that you're absolutely confident and competent with every aspect. So we have included things around communication skills. Remote consultations have been a challenge for us all throughout the pandemic. And they are here to stay, I would think. It's really quite an efficient way of working, and the patients like it because they don't have to travel into the surgery. So I do think that's going to stay for quite some time, or forever. We've looked at some of the IT skills needed around general practice and that interrogation of that clinical system. And we're conscious that there's more than one clinical system that you'd possibly need to use. If you're lucky enough that your network has just got one system and that you're working with, that's great. But we're trying to make sure that you've got the absolute best tools that you can have to do your job. So within that, it would link in with embedding MRHA alerts within practice. And the theory behind that is looking at how your day-to-day job, your bread and butter would be patient safety, and typically some of these things come through as the alerts that we receive. How would you then walk through implementing that in practice? Because it can involve implementing some change into practices. And if you are employed at network level and you've got experience working with the practices, it can be difficult enough working with a single practice, let alone working with 8 or 9, all with different opinions. So it really can be quite challenging. So it would walk you through how to do it and then how to implement it so that you can embed that change. And it's not just a fire and forget audit, it's something that can last and can really improve patient care. We then tagged in some biosocial assessments so that you can really understand the kind of social determinants of health and add that extra layer to reviewing patients face to face so that you can really do a thorough risk assessment of future health problems. Because within primary care and general practice, as you know, we're the only discipline, part of the NHS, where we have no referral criteria, we have no discharge criteria, and we've got you from cradle to grave. And a lot of our work that we do, we never ever get to see that it's been a benefit because we've prevented that problem. And that's our whole remit. So although that could almost seem like a thankless task, it's understanding those modifiable and non-modifiable risks and being able to highlight them and then signpost on as appropriate. Or indeed, if the willingness and ability was there, do something about it there and then. We've then included a day on clinical skills. So this would look around the needs that if you needed to understand how to do an ECG, inhaler technique is really an obvious one as well to include if that's not a skill you've already got, that we can implement that. Blood pressure monitoring and management. And there's a few other bits and pieces in there that we thought would be really quite useful within primary care. Alongside that, we've also added in venipuncture. And the rationale behind these, because you could easily be forgiven for looking at that and thinking that's a healthcare assistant's job. Is that not? If you've not got the roles wrong, though, you're trying to replace us with something else. And it's not. It's because if you take a step back and look at that, you could easily be, forgiven for thinking that's actually a nurse job. That could be a physician associate job. It could be actually a GP assistant job. And the underlying message actually is it's a general practice job, it's primary care's job. So these are tasks and functions and skills that we needed embedded within primary care so that we can make every contact count. And within your role, which is so heavily embedded with patient safety, how this would kind of link in is if you're working at network level, you might be working as part of looking at some of the shared care work and monitoring DMARDs. We've gone through 18 months, if not more, where we've paused routine blood monitoring. And for as much as those patients who are on a DMARD by virtue of them being on the DMAD means that they're not routine. But actually the flip side is they didn't want to come out and they didn't want to go to any public place to have blood taken. They didn't want to let anyone in. And the national pause around the shortage of blood bottles, there's actually a massive gap there around where we've got patient safety issues where things just haven't been monitored. So there's this huge gap that could be filled and improvements occur. So then we cover some sessions around long-term condition monitoring and management. So it's disease specific, but also an overarching overview. And the remit behind that is to get an understanding of the medications and safety issues behind it specific to certain diseases, but also to add that added extra layer of interest into your role so you get a good understanding of the medical issues behind, not just the pharmacological things that you're looking at. And then, as always, my favourite is frailty and deprescribing. I think everyone should do that. I'm quite biased there. I think that topic will always be a hot topic, and I think everybody should include that as part of their day-to-day job, because this is something that we really should make every contact count to make sure that we're flagging this and we're screening people for either frailty or seeing if there's things that we can actually highlight that aren't being used, aren't needed, causing problems that we could possibly reduce or stop. Then we've included group consultations, and again, this has been one of the common themes that we've kind of threaded through a little bit, because we think that I don't think this has reached its full potential yet. And I think within the R's roles, within which pharmacy techs fall into, I think it's a really good place to be, that you could look at certain aspects and elements of care that you rather repeating yourselves on a one-to-one basis, you could do as a group, and you could get that peer support for patients. Then we looked at some really practicalities around the role of the pharmacy technician within networks and practices. And it was looking at a session around implementing the quality outcome framework and also some of the direct enhanced services, and tying that into specifically into relation to you as a pharmacy technician. So where do you fit? How does that fit with you? How can you make that contact count? What the horizon scanning behind that and understanding the rationale so that we can embed all this and make sure it's threaded through our everyday work. We've included the 2-day vaccines training. So at the end of the 20 weeks, if you're yourself are willing, of course, and the network want you to be able to do this, you can attend the 2-day course and actually be an immuniser. You need to obviously follow a patient-specific directive, but as COVID isn't going away and we're going to have the boosters for some time ahead, the national task around vaccination will remain massive. So I think it'd be really useful that if you are in a care home, as part of your role, you might need to vaccinate alongside another registered colleague, or even in practice, or again at the mass vaccination clinics. And it's just really enriching in that role and including everything that potentially you could do. We've got some skills in there around leadership, which again we've threaded through all the GP Ready programs, which is just to help pad on leadership and change. And we've included some quality improvements, which is our colleagues at Aqua that we've got to deliver throughout all the courses, which is starts off with a 3-day course, but the dates aren't set for that, unfortunately, because we're reliant on them. It's on numbers and booking the courses, which any questions around that within the course, Rob will pick those up because he's liaising directly to book those in. So what do we need from you? Well, there's no entrance criteria. So one of the previous questions we've been asked is, do you need to have done X, Y, and Z or CPPE or anything else? And absolutely not. This is available to anybody that's new to practice, new to primary care. So it's to help assist in the embedding of that role and to really make sure you feel really confident and competent in practice, and that we've got this peer support network, because across GM, and it's not been area specific and it hasn't been role specific, we know that this transition across to primary care hasn't been really as smooth as I suppose it looked on paper. It is a different culture, it's a different world. So it's to make sure that you feel you've got that network around you and that you can develop and be supported. It'll typically be a session a week, but as I previously mentioned, there's a full day for clinical skills, and there's the 2-day vaccines. Alongside the commitment for this, though, you would need agreement from your network to release you, unless you wanted to attend in your own time. But ideally, this should make up part of your working week. And the benefits to you, well, you've got access to the free course for a start, because there's no charge attached to that. There's quite a really comprehensive mix in there. We've also included some clinical supervision resources, which is more for the PCN level to ask us to communicate with us. But you need to know that it's there and that we've considered this, because clinical supervision is vital irrespective of role. Everybody should have some clinical supervision, and I really do feel it should punctuate your working week. It shouldn't be in a corridor, it shouldn't be ideally over a dinner table. It should be part of your working week to make sure that you've got that chance to debrief, to mull over a clinical case, or to ask clinical queries. So it's how we can kind of embed that best practice. But the aspiration of this will help to embed your role into primary care, so we can see where it really fits, so that you can really deliver as much as you possibly can. And this will also help relieve any practice burden of training that would feel to be needed, because we can deliver it en masse and have this standardised approach. It takes away that pressure from the practice or the network for that one-to-one support. So then again, it can release time for the supervision that you need as well. And that's really a whistle-stop tour, can't speak, of the programme. Does anyone have any questions?
Feel free to if you don't want to speak.
Hello, it's Stephen.
Hi, Stephen.
Hi. Just a quick question. I noticed you mentioned it's around one session a week. Is that the times which it was mentioned in the original information? I think it was either a Tuesday or Wednesday between 1 and 4. Is that right? Yeah.
Yeah. Okay. Yeah, it is.
Okay, brilliant. And is that just going to be something we can access whilst we're in practice, or is it that really down to kind of who we're employed by, whether they want to do it within practice or whether we can be released out of practice to be able to do it?
I think it should make up your core hours.
Yeah, okay.
Because it's around your professional development, but it does need to be negotiated with whoever's employing you, because typically it's the network. But I do think as this is a benefit to your employer, it should make up part of your core hours ideally.
Okay, great. Thanks very much.
Predominantly, it should be delivered virtually. There's only those few practical days which will be in person.
Great, fantastic. Thanks very much.
Any other questions from anyone?
I'm just going to add that, sorry, my signal just went a bit funny there, but in case it wasn't mentioned, from someone who has been training technicians and pre-regs and has done the prescribing course myself over the last sort of couple of years, I would caution about doing any sort of course, especially because it's, 1 till 4, it's a significant period of time, physically on the premises. I think the temptation for the practice staff to know that you're there and to just pop in with various things that need doing is quite tempting, and to have one eye on this and one eye on the computer doing a couple of reorts while you're doing it, it's a bit of a slippery slope, as tempting as it is. So as a learner myself recently, I would personally segregate yourself to a certain degree, put some sort of physical, metaphorical barrier there to your time, because that protected time is really, really important to be able to focus on that learning.
Yeah, thanks, Sean.
We've got a question in the chat. So where are the practical sessions to be held? And the answer to that is we don't know yet. We've run the venipuncture and the in-person ones at many places across Greater Manchester because we've run them as it's part of the CPD, Sam, that many people take advantage of it. So it's part of CPD funding. So it will depend on a variety of things. If there's like a lot of people that are in one geographical area, then I'll probably look there to book somewhere. Otherwise, we'll always be looking for somewhere with good transport links anyway, but they haven't been decided yet.
One of the influencing factors has been around the numbers as well, because obviously the room that we need to book will be dictated by how many people will need to be in the room. And for as much as what will hold a lot will hold a little, it then would impact on booking and availability though. So we've held back a little bit so we get more of an idea of numbers.
The next question in the chat is, will there be a lot of work outside the sessions like PEP workshops?
No, the clinical skills will include, all of the clinical skills will include a competency workbook that you'll be given, that you'll need to be signed off in practice, because from a clinical skill point of view, we can't deem you competent, we can only teach you the theory and the practical. You then need to apply it to practice. That would be the only work that we would we'd hand over to you to get signed off to maintain and improve competence.
Yeah. Any more questions? Nothing at the moment.
If you think of any further questions, because I always tend to mull over it when in my life, it's usually when I'm doing something else, it pops into my head. So it'll be when I'm either cooking or doing some cleaning somewhere. I think something, just you can get in touch with us. You've got Rob's email. We can put the link to the web. Rob's already done it. He's put the link to the website into the chat, and you can contact us there, and we'll get back to you as soon as physically possible. It's manned by Rob, and he's really really efficient with that. So you will get an answer. And it's typically within 48 working hours. Rob, would you say is a good
I'll
time
try
to get?
next week, but I'll try to get to that to you like really quick. And if you want to sell your employees on this, we're happy to speak to employers. If they've got any questions, they can obviously email us. On the website I've just put in there is the formal way you can formally express your interest and sign up if you haven't done already. I know a few you might have done. But Carol's got a question, not to keep you any longer.
Yeah, you sort of beat me to it, Rob. What I was going to suggest was, is there anything that we can give to the guys on the call to take back to their employer as a bit of a selling point? So what's the benefit to the PCN, to the practices? Is there anything we can provide them with in terms of hints and tips in terms of getting their employer to agree to allow them to join the programme?
Let me show you the slide from earlier, the one that Sam wrote.
I think that's a really good point though, Carl. We could do a frequently asked questions, couldn't we, that could go out as part of the comms. I think that'd be, we'll set that back.
This is the webinar we gave to the employers this afternoon, or this slideshow. It's just bringing it up now, and we had a slide on there which is benefits to the employer. So if they're looking to supervise you, or do you want to go through it, Sam, rather than me? Sorry, I was just
you're on a roll. I was just quite happy to let you in. You're quite enthusiastic, Rob, so I didn't want to stop you in your track. We've lived and breathed this for some time, haven't we? So we're all really, the whole team's really passionate about all the GP Ready programs, and it's fantastic to be part of the delivery arm of it. So the benefits to the employer are the same pretty much as they are to the employee, and it's the big question is around the clinical supervision resource, and I think they'd be quite interested in that. It's a discussion topic in its own right, so it's point them in our direction and say that there's something that I think that would hook them in a little bit. But it's around that helping to embed you into practice and have a really good induction. And we'd love some of your feedback as well as to how you think anything could be improved, or what your takes of working in general practice, what your take on that is. And I think some of the bigger benefits is the course is free for employers, so there's no financial costs. They don't need to pay for it. Vaccines, for example, there's usually always a cost attached to that. They don't need to worry about delivering the training themselves because we've put the package on. So it's about freeing up that time for them too, so that they can focus on clinical supervision and the day job.
The webinar I gave to them this afternoon, that's on the website as well. So if you want to set, it will be on the website probably in the next 48 hours. And we've got a question from Johnny to the technicians in the room. So Johnny is from GM Health and Social Care Partnership, who are funding the programme. So yeah, if you've got any comments about the course content, what do you think? Pop it in the chat. Do you like it? Do you want something different? Do you want something more?
It's just kind of what you think about it, because I mean, it is new. It's fresh, Sam. It's something that I've not heard technicians be a part of before. Might be wrong. Shan, am I wrong?
Do you mean the venipuncturing specifically?
Yeah, stuff. There's venipuncture. I'm not sure if technicians do blood pressure and other things that we've mentioned without there in the community. And I'll give you a bit of background from where I'm from. I used to be a pharmacy technician from secondary care for 21 years.
Okay.
So I worked at Bolton Hospital for 21 years. And now changed roles, obviously. But when I saw this, I was kind of excited as a technician that these are new branching areas of support that we've not done before, that I've not seen before. So and for your knowledge, I wasn't sure whether this was something that had been done out in primary care before.
Venipuncture isn't something that I've seen technicians do before, but as soon as I saw it, my initial instinct was that, oh, okay, what are we doing here? This is a bit different. And then as soon as the cogs start whirring, I instantly start thinking about, well, why couldn't they? We teach phlebotomists who, haven't had previous healthcare experience before. You can go from working in Asda to working as a phlebotomist after, appropriate training.
Yep.
So there's no reason why they wouldn't. And, and I instantly start thinking about my team that I've got and thinking about the DMARDs, about the atypical antipsychotics, about the diabetes clinic, and thinking that they could come in, sit down, have that hallowed face-to-face chat with a person in the surgery. They can have a chat about how are they taking their medications, are they managing to remember everything? Do they need any compliance aids? Do they need to chat about this? They can start that process of signposting. Do they need the clinical pharmacist? Even before we're doing the venipuncture, do they need the clinical pharmacist? Actually, are they having trouble with that jippy knee and they need to get in and they haven't been able to call up the practice, etc., etc. So I instantly start thinking of what that clinic might look like and how they could work with the pharmacist around those shared care drugs and around those long-term conditions and how that would work. And working alongside the HCAs to do that role, because I was thinking, do we definitely need that alongside the HCAs? But actually, I think that could really complement it really well. I haven't seen them done before, but technicians have been doing immunizations for a while, I believe, and I think that they complement each other really well. Those winter clinics coming in, get your jab, get your DMARD bloods, and off you go. I think it could work really, really well. It's really quite exciting. And as a pharmacist, I haven't done venipuncture yet. And it's making me think that actually I need to be upskilling myself here. If my technicians are going to be so highly qualified, I think, it's going to light a bit of fire under my bottom, certainly.
Yeah, no, that's brilliant. That's excellent. Just thought I'd ask the technicians in the room, because obviously I've been away from the business, if you like, for 4 years. So coming back is what's the feeling around that? And it sounds like someone's, Stephen, I think, put something on. And Louise, is it?
So a bit nerve-wracking, but very useful to the practice. Vaccination training, very exciting, very useful.
Yeah. And it ties into the current situation, doesn't it, and going into the future. It's really quite smart, because we've just created the primary care passport for vaccinations around Greater Manchester, and the technician role is on. It is on as a vaccinator, so it's really good to get that interest.
Yeah, I'm coming back from mat leave, and the first thing I'm going to be doing is getting my IMS training sorted.
Excellent.
I'm sure I get that sorted, because I think that's going to be absolutely key. And alongside everything with COVID, is being able to deliver QOF for the practice as well when you do need those people to come in. And it's other things like, we've got a few people on lithium, they need their blood test as well. And actually you need your correct trough level. Occasionally we're asked to do something like a digoxin level, things like that. We don't do them much in primary care, but they are there. Your nurse gets them in at whatever sort of time, and actually your level comes back this or it comes back that, and then you need your pharmacy input to go, oh, well, actually that's because you took it at this time and not that time. So those sort of things, those really niche sort of safety elements, but are there as part of the core contract, as part of QOF, as part of DES, are going to be really, really key, actually.
Yeah,
no, it's really good.
It's exciting.
Thank you very much.
Yeah, I'm glad the comments in the chat are very positive about that. So any more questions?
Just to answer Louise's question, the training around blood results will be incorporated in the disease-specific elements. So as opposed to a session on blood result interpretation, it'll be included as to what you would be able to understand and review a patient from that specific condition, if that makes sense. So we cover HbA1c and a little bit of UNE and a lipid profile within diabetes. And equally, we do some proactive cardiovascular disease prevention within COPD and respiratory disease, because unfortunately, if smoking has caused chronic obstructive pulmonary disease, you've also smoked for long enough to develop heart disease as well. So it's the tying in of the relevance of that. So as opposed to an extra session, it'll be threaded through in disease specific.
So I was just checking but I think you can't check online, but I can check for you and it'll take me 30 seconds. So let me just see. Andrea, no, you're not one of the ones. I'll put the link just to sign up specifically to confirm you sign up. Or to put in the EOI, should I say, Andrea? So yeah, there we go. It's available on our website as well if you want to. So anyone, don't worry about if you lose it. It's on the chat. It's on the. Louise, you have filled it in. Yes, that's the correct one that you've done, Louise. Yeah. So what will happen now is once we get all the expressions of interest in the next week or two, I'll start sending you like diary links and letting you know how to onboard once we've confirmed our number of places and where everyone's able to come from. So that'll probably be in the next week or two. We'll get everything set up for you. So anyone else, you can fill it in, or your employer can fill it in. But if you and there'll probably be some other confirmation that we'll need from your employer, but Sam will sort that out with all the induction material, with any sort of paperwork that we need. Oh, Carol's got a question. Hand up again.
Not a question, it's an ask. So we mentioned it before. Can we put the GMTH Twitter account on there, Rob?
Yeah.
And I love the fact that everybody loves the programme. So if everybody can retweet about the programme, that would be really helpful. The more people we get on, the more we can prove that it works and that people are enjoying the programme and sell it to do it again in the future. So your networks are the best place to get this word out there. So if you can retweet anything that we tweet about the programme, that would be great. Thank you very much.
Fantastic. And yeah, if you've got anyone in your practice you come across first contact practitioners, physician associates, we've got GP ready programs for them. Come across newly qualified nurses, we've got a fellowship for them, and any newly qualified GPs, we've got a fellowship for them. So and hopefully with that aqua course is one way you'll be able to interact with many other people with different jobs too.
That's great. So keep your questions coming. I love questions. It proves that you're thinking about it, and I just love being curious. So feel free to ask away, and there's no such thing as a stupid question ever. So I hope it's been informative, and if you've got any further questions, please send them through, and we look forward to seeing you on the course. Great.
Thank you very much.
Yep, so thank you all for coming, and I hope you enjoy the rest of your Tuesday evening.
And so someone's just filled in an expression of interest already. So I'm just going to stop the recording now.